So in the last lecture, we discussed about the developmental disturbances of gingiva and developmental disturbances of oral mucosa. Today we discuss about the developmental disturbances of the tongue. In that, first is the glossia, means absence of the tongue. Microglossia means small tongue. Macro means large tongue. Then cleft tongue. Cleft tongue means it is an anomaly which is present between the dorsal surface of the tongue and the cleft which is present in the middle portion of the tongue. The next anomaly is the fissured tongue. Fissured tongue, it is also called as scrotal tongue, furrowed tongue, lingua placata, placated tongue, cerebriform tongue, and grooved tongue. This is also asked in a internal exams for short answer question. Then next, what are the clinical features of a fissured tongue? This is the clinical picture of the fissured tongue. See, these fissures, these are multiple and these are always interconnected, and they are 6 mm in depth. Fissured tongue is a condition, it is frequently seen, that is characterized by grooves that are frequently found on the dorsal and lateral aspects of the tongue. The depth of a fissure varies, but it has a depth of 6 mm, and these grooves are interconnected. And the etiology of the fissured tongue is unknown, but the fissured tongue is associated with the Melkerson-Rosenthal syndrome. This syndrome is important for you. What is Melkerson-Rosenthal syndrome? In Melkerson-Rosenthal syndrome, it consists of a triad. That is, 3 features are there. First feature is recurring lip or facial swelling. Then 7th nerve, that is facial nerve paralysis and fissured tongue. This question can be asked in your MCQs. What is Melkerson-Rosenthal syndrome? It consists of a triad, that is recurring lip or facial swelling, first thing. Then 7th nerve paralysis and fissured tongue. This is the clinical picture of your fissured tongue. Then what is the clinical feature? First is the in this slide male predilection is there. The fissured tongue is a totally benign condition. The lesions are asymptomatic, but the debris is engrafted fissure cause irritation. That is bacterial accumulation cause the irritation of the tongue. The condition may be evident at birth, that is congenital, or during childhood. It is diagnosed more frequently in the adult. The prominence of the condition is increases with the increasing age. Then microscopic feature, first is hyperplasia of the retipex, means long thin retiridges are there. Then loss of keratin hairs on the surface of filiform papillae, and these papillae are separated by deep grooves on the which is present on the dorsal and lateral aspect of the tongue. The next histopathological feature, in that the microabscesses are present in the upper epithelial layer and inflammatory cell infiltrate is there, that is mixed inflammatory infiltrate. Now what is mixed inflammatory infiltrate? Means there are acute cells also and chronic cells also. Acute cells and chronic inflammatory infiltrate is called as a mixed inflammatory infiltrate in the lamina propria. Then what is the treatment plan for your fissured tongue? No treatment is necessary, but if the bacterial accumulation is there, then patient should be advised to brush the tongue, since groove may act as a bacterial accumulation and it causes irritation of the tongue. The next anomaly, next developmental disturbance is geographic tongue. See the clinical picture of the geographic tongue. This is the clinical picture of your geographic tongue. It is also called as benign migratory glossitis, or it is also called as erythema migrans or psoriasiform mucositis. It is also a benign condition and it occurs in 3% of the general population. This is important for you. What is geographic tongue? It is also called as benign migratory glossitis. The next thing is, what are the etiological factor for your geographic tongue? First thing, it is etiology may be hypersensitivity or due to the environmental factor or due to the hormonal factor. Although this is also an inflammatory condition and the polygenic mode of inheritance has been there. It is associated with the human leukocyte antigen DR5 and human leukocyte antigen DRW6. This is also important for your MCQ. The question is, geographic tongue is associated with human leukocyte antigen DR5 and human leukocyte antigen DRW6. It is seen in increased frequency in patient with psoriasis. So it is called as a psoriasiform mucositis because it is frequently seen in the patients with psoriasis. Psoriasis is a skin disease and in patients with fissured tongue. Then what are the clinical feature of your geographic tongue, which is also called as what? Benign migratory glossitis. It can affect all age group. However, it is more predominantly seen in the adult patient. Females have been reported to be affected twice as often as male. And what are the what patients complain? It patients complain maybe a burning sensation or irritation due to the bacterial accumulation on the tongue noted with the hot and spicy food. These are the clinical features of your benign migratory glossitis. Then classic manifestation of this lesion is important. The classic manifestation of geographic tongue or benign migratory glossitis is an area of erythema. It is with the atrophy of the filiform papillae. What is atrophy? Means reduced thickness of the papillae of the tongue, and it is surrounded by serpiginous white hyperkeratotic border. This is important for you. First thing, what is the characteristic presentation of your geographic tongue? First, it is an erythema with atrophy of the filiform papillae, erythematous lesion. There is the atrophy of the filiform papillae, and it is lined by a serpiginous white hyperkeratotic border. It is primarily affects at the dorsum and often extending to involve the lateral border of the tongue. See the clinical features. See this black arrow. This is what? Erythematous area, and it is lined by a white hyperkeratotic border. So it is also called as what? Benign migratory glossitis. Then histological feature, microscopically, it is described as psoriasiform mucositis. At the periphery of the lesion, the elongation of the retiridges means thin and slender retiridges are there in benign migratory glossitis with associated hyperparakeratosis. What is hyperparakeratosis? Means it is the abnormal thickening of parakeratin is there. Normal keratin layer is two layers, but in hyperparakeratosis, there are 5 to 6 layers of keratin may be seen, and acanthosis is there. What is acanthosis? It is the increased thickness of the stratum spinosum layer toward the center of the lesion, means the erythematous area. It is surrounded, erythematous area means reddish area, and the erythematous area clinically, it has a no papillae or a loss of filiform papillae is there. The next is predominant inflammatory infiltrate is there in the lamina propria, that is acute inflammatory cell, that is neutrophil with an admixture of chronic inflammatory cell, means mixed inflammatory infiltrate is there. Then treatment, no treatment is necessary because the lesion is benign and it is asymptomatic, but in severe cases topical corticosteroids can be prescribed. Then the next anomaly is the median rhomboid glossitis. What is the meaning median? Median means the lesion is present in the center of the lesion. What is rhomboid? Means see this shape. This is the rhomboid shape of the tongue. Then glossitis. Glossitis means what? Inflammation of the tongue. What is median rhomboid glossitis? It is also called as a central papillary atrophy because this lesion is seen in the center of the tongue. So it is called as a central papillary atrophy or posterior lingual papillary atrophy. It is a focal area. Focal means what? It is present in the one particular area. Focal means localized, and diffuse means it is a widespread lesion. Median rhomboid glossitis is a central, means it is present in the center of the lesion, central papillary atrophy or posterior lingual papillary atrophy. It is a focal area of susceptibility to recurring or chronic atrophic candidiasis. See this clinical picture of median rhomboid glossitis. The lesion is present in the center of the lesion. See this erythematous lesion. Then etiology of this lesion, median rhomboid glossitis. The embryonic tongue. This is unilateral swelling and hypobrachial eminence. During this period of fusion, the posterior dorsal point of the fusion is occasionally defective, and this leads to if the defects in the development of the tongue. that is from the two lateral lingual swelling is defective, then they form a leaving a rhomboid shaped lesion, that is the smooth erythematous area. They lack papillae, that is from papillae or testbud derived from this. This erythematous clinical appearance is due to the absence of filiform papillae in this region rather than to the local inflammatory gel. In general, the median rhomboid glossitis. What is median rhomboid glossitis? It is development of tongue is from the two lateral lingual swelling with a hypobrachial eminence. If and they form the tongue. If the two lateral lingual swelling defect is there, then the rhomboid shape anomaly or developmental disturbances is formed, and it is the erythematous area, and they lack the filiform papillae. Then clinical feature, the lesion is found in 1 of every 300 to 2000 adults. Depending on the rigor of clinical examination, it shows a slight male predilection. What is the clinical presentation of the median rhomboid glossitis? It is present in the posterior midline of the dorsum of the tongue, just anterior to the V-shaped grouping of the circumvallate papillae. This is important for you. What is the location of median rhomboid glossitis? It is present in the posterior midline of the dorsum of the tongue. Location of the median rhomboid glossitis is just anterior to the V-shaped grouping of the circumvallate papillae. This is important for your MCQs. The long axis of the rhomboid or oval area of red deep papillation is in the anterior and the posterior direction. The lesions are typically less than 2 cm in diameter in greatest dimension, and most demonstrate a smooth flat surface, although it is not unusual for the surface to be lobulated. None has been reported posterior to the circumvallate papillae because the lesion is always present anterior to the circumvallate papillae. This is the lesion, that is median rhomboid glossitis. See the center of the lesion, see the erythematous area in this loss of papillae is there. Then microscopy, silver staining and past stain. Past stain detects what? Candida infection. Candida infection is a fungal infection. Silver staining and past staining is done for this lesion. They will often reveal a candidial hyphae. You know the candidial hyphae spores on the superficial layers of the epithelium. So past stain detects the candidial hyphae. They recommended that the patient be treated with topical antifungal prior to biopsy of a suspected median rhomboid glossitis. Then treatment, no treatment is necessary for median rhomboid glossitis, but the nodular cases are often removed for the microscopic examination. The antifungal therapy will reduce the clinical erythema and inflammation due to the candida infection or due to the fungal infection. They cause irritation of the tongue. That irritation due to the bacterial accumulation on the center of the lesion. So the treatment option, if the burning sensation of tongue is there, then the treatment option for the medial rhomboid glossitis is antifungal therapy. The next anomaly is the lingual thyroid nodule. See the clinical picture. This is your tongue. This is your lingual thyroid nodule. Nodule means what? Nodule means it is an abnormal growth of the tissue. Okay. What is lingual thyroid nodule? It is an accessory accumulation of thyroid tissue that is usually functional within the posterior body of the tongue. What is the location of the lingual thyroid nodule? It is located on the posterior part of the tongue, and it is a accessory accumulation of the thyroid tissue. Why it is formed? What is the causative factor for a lingual thyroid nodule? What is the etiology? First thing, late in the first month of intrauterine life, the annulage means the remnants of the thyroid gland descends from the posterior dorsal midline of the tongue to its final position in the lower neck. If they do not descend normally, then the ectopic or residual tissue is present may be found between the foramen cecum and the epiglottis. And this gives a nodular structure which is present in the posterior most part of the tongue. And this is called as a lingual thyroid nodule. Then what are the clinical features? It is more common in females than in males. It presents as asymptomatic painless nodular mass in the posterior lingual midline or posterior most portion of your tongue, usually less than a centimeter in size, but sometimes reaching 4 centimeter in size. Larger lesion can interfere because what? Larger lesion can interfere with your swallowing difficulty, speech difficulty, breathing difficulty, but most patients are unaware of the mass at the time of diagnosis, which is usually teenage or young adult patient. See this black arrow. This is your lingual thyroid nodule, which is present in the posterior most portion of the tongue. Then microscopic feature, lingual thyroid nodule, it consists of a non-encapsulated collection of embryonic or mature thyroid follicle which may extend between the muscle bundle. This is the histopathology of your lingual thyroid nodule. It mainly consists of mature thyroid follicle. Mature thyroid follicle is seen on the histopathological examination. Then next is lingual varicosity. What is varix? Varix means abnormal, tortuous, prominent vein. Okay, varicosities. Lingual varicosities means prominent, tortuous lingual vein. It is usually observed on the ventral and lateral surface of tongue. This location is important. See, these are two clinical feature of your lingual varicosity. This is your ventral surface of tongue, right? See the purplish color of this vein. This is the dilated tortuous vein. It is called as a lingual varicosities. It is a developmental disturbances of your tongue. Prominent. What is varicosities? It is a prominent dilated tortuous vein. Prominent dilated tortuous lingual vein usually observed on the ventral and lateral surface of the tongue, and these are called as lingual varicosities. These are hemorrhoid. Hemorrhoid means what? Dilated vein, dilated tortuous vein. Why this is formed? Due to the, it is caused by the decrease in the amount of surrounding connective tissue or increased hydrostatic pressure causes lingual varicosity. So what are the causes for the lingual varicosity? First cause is increased hydrostatic pressure, and second one is a decrease in the amount of surrounding connective tissue. This leads to a lingual varicosity, and most common location of lingual varicosity is on the ventral and lateral surface of your tongue. Its occurrence increases with age or increased blood pressure, and it is a normal variant in adult over 60 years of age, believed to be related to your aging process. So this lesion is most commonly seen in the older adults only. These are two clinical feature of your lingual varicosity. See the enlarged vein. This is your ventral surface of tongue. Enlarged vein, usually what is the color of the lingual varicosity? It is a purple or red, which is present between the cluster. It is most commonly seen in the ventral and lateral surface of your tongue. And then microscopy revealed dilated vein, that is main thing in the varicosities. It consists of a dilated tortuous vein. So on the microscopy, on histopathological examination, they reveal dilated veins only. Dilated veins with walls showing little smooth muscle and poorly developed elastic tissue. Treatment is not necessary because the condition or the developmental disturbance is asymptomatic. So the next is the hairy tongue, developmental disturbances of the tongue. Next is the hairy tongue. See, this is the clinical picture of your hairy tongue. In the hairy tongue, there is a hypertrophy of the filiform papillae. What is hypertrophy? It is the increased size of the cells. It is called as a hypertrophy. What is hairy tongue? This anomaly is also seen in older adults. It is a commonly observed condition of a defective disformation of the filiform papillae that results from a variety of precipitating factors. What are the precipitating factors for hairy tongue? It may be because of the coffee and tea. It may be seen in patients with coffee, excessive use of coffee and tea drinker, excessive use of broad spectrum antibiotic. So, and it is most commonly seen in the older adults. These are all clinical features. See the hypertrophy of the filiform papillae is there. See the color of the lesion. It is a black lesion. Other color green color is also there. The condition is most frequently referred to as black hairy tongue. It is also called as lingua villosa nigra. This is also an MCQ question. What is the other names for a hairy tongue? It is also called as lingua villosa nigra. It is most commonly seen in HIV patients and male patients. The hairy tongue developmental disturbance is most commonly seen in male patient and in HIV patient. Hairy tongue may also appear. So what is the color? It may be brown, white, green, pink, or any variety of hues depending on the specific etiology and the secondary factor. Then what is the etiology of the black hairy tongue? First, the basic defect in hairy tongue is due to the hypertrophy. What is hypertrophy? It is the increased size of the filiform papillae. What is the etiological factor of your hairy tongue? It is a basic defect in the hairy tongue. It is a hypertrophy of the filiform papillae. This anomaly is seen on the dorsal surface of the tongue with lack of normal distribution. Then contributive factor, what are the etiological factor of your hairy tongue? Hairy tongue are numerous and include poor oral hygiene, that is excessive tobacco, coffee and tea drinking, the use of medication, that is broad spectrum antibiotic and therapeutic radiation. These are all contributing factor for hairy tongue. What are the contributing factor? First one is poor oral hygiene. Next is tobacco use, then coffee and tea drinking, the use of medication, that is broad spectrum antibiotic and therapeutic radiation of the head and neck. These are all contributing factor for your hairy tongue, for the formation of hairy tongue. Then the next is clinical features of hairy tongue. Normal filiform papillae is approximately 1 mm in length, but in hairy tongue, the filiform papillae is up to 15 mm in length. Why? Because there is a hypertrophy of the filiform papillae. So in the hairy tongue, the filiform papillae is measured at about 15 mm in length. It is rarely symptomatic, although overgrowth of Candida albicans may result in glossopyrosis. What is glossopyrosis? Burning tongue. Why burning tongue in the hairy tongue? Because there is an accumulation of bacterial accumulation in the dorsal surface of the tongue that leads to a candidal infection that leads to glossopyrosis. Glossopyrosis means a burning tongue. Patient frequently complain of a tingling sensation in the soft palate and the oral pharynx during swallowing. Patient may complain of gagging sensation due to the candida infection or due to the bacterial accumulation on the dorsal surface of the tongue. Patient may complain of gagging sensation, retention of the oral debris, that is bacterial accumulation between the elongated papillae may result in a halitosis, that is bad breath. Why this occurs? Because of the bacterial accumulation on the dorsal surface of the tongue. Hairy tongue is reported more common in males. The incidence and prevalence of hairy tongue is increases with age. This lesion is also seen in the older adult, and most common thing is it is present in the HIV patient or immunocompromised individual. The tongue has a thick coating in the middle, and the bacterial and fungal overgrowth may play in the role in the color of the tongue. See, these are the clinical feature of your hairy tongue. See the papillae, it is a hypertrophic papillae, filiform papillae in hairy tongue. Hypertrophy of the filiform papillae is there. See the color of the lesion, it may be green, black, white or brownish in color. Then microscopic finding, this consists of elongated filiform papillae, that is hypertrophy of the filiform papillae. It is finding accumulated debris intermingled among the papillae. That is what debris means. Bacterial accumulation is there, infection is there, so inflammatory infiltrate is there. Chronic inflammatory infiltrate is there among the papillae. The cytological smear stained with gram stain or pars stain reveal the candida organism. This pars stain reveal what? Candidial hyphae. Okay. The treatment for this lesion or developmental disturbance is brush the tongue to promote desquamation and remove the debris. The next developmental disturbance is the size of the teeth. In the size of the teeth, microdontia is there and macrodontia is there. What is microdontia? Micro means small, dontia means teeth. What is macrodontia? Macro means large and dontia means teeth. These two anomalies are under the developmental disturbances in the size of teeth. First anomaly is microdontia. Micro means small teeth and macro means large teeth. First, we discuss about the microdontia. That is, it is a smaller teeth than the normal teeth. Then the classification of microdontia. First is true generalized, relative generalized, and microdontia involving single tooth. First, we discuss about the true generalized microdontia. True generalized microdontia means what? This is a true lesion, means real. True generalized means this anomaly is seen in all over the teeth. Okay, so what is true generalized microdontia? All the teeth means they affect all the teeth. All the teeth, they are smaller than the normal. Example for this is a pituitary dwarfism patient. There is a microdontia. Microdontia means true generalized microdontia means all the teeth are affected. That is the all the teeth are the smaller than the normal teeth. The next classification is relative generalized microdontia. Relative means not true. Some teeth are affected by the developmental disturbance. This is also a generalized condition. Relative generalized microdontia means normal or slightly smaller than normal teeth are present in the jaws. Then third classification is the microdontia involving single tooth. In this developmental disturbance, only one tooth is affected by microdontia. It may be for this anomaly. Example is two teeth are involved. That is maxillary lateral incisor and third molar. Most commonly, maxillary lateral incisor is involved and is called as a peg lateral teeth. So, what is the classification of microdontia? Three types: true generalized, relative generalized, and microdontia involving single tooth. True generalized means all the teeth are smaller than the normal. Relative generalized, few or slightly teeth are smaller than the normal, and microdontia involving single tooth means this developmental disturbance affect only single tooth. It may be maxillary lateral incisor or the third molar. Example, peg lateral. See, this is your peg lateral. This is the microdontia involving a single tooth. See, this is your peg lateral. See, the mesial and the distal margins are tapered. This is an example of your microdontia involving the single tooth. This is also a peg lateral, that is microdontia involving single tooth. This is a true generalized microdontia, means all the teeth are smaller than the normal teeth. That is first, true generalized. And true means real, that is all the teeth are smaller than the normal. Generalized means it affects all the teeth. The next developmental disturbance is macrodontia. Again, macro means large, dontia means teeth. It refers to, what is the definition of macrodontia? It refers to teeth that are larger than the normal teeth. What is macrodontia classification? This is important. Again, this is important for you. First thing, same that of the microdontia. Macrodontia means true generalized, relative generalized, and macrodontia involving single tooth. First, we discuss about the true generalized macrodontia. What is true means real, means all the teeth are the larger than the normal teeth. Generalized means it affects all teeth. True generalized macrodontia means all teeth are larger than normal. Then relative generalized macrodontia means slightly larger teeth in small jaws. And third one is macrodontia involving single tooth. It is also a common condition. And next is hemihypertrophy of the face. Hemihypertrophy means hemi means one side of the face is affected. Hemihypertrophy means increased size of the one side of the face. It can be seen, but not at the time. This can be seen. This anomaly can be seen with the microdontia. So this is the classification of your microdontia. First is true generalized, relative generalized, and involving a single tooth. This is a microdontia involving a single tooth. See the clinical picture of the microdontia. The teeth are larger in size than that of the normal teeth. Then next is the developmental disturbance in shape of teeth. In the developmental disturbance in shape of teeth, there are developmental disturbances in shape of teeth. First is gemination. then fusion is there, then concrescence, dilaceration, dense invaginatus is there, dense invaginatus is there. First, we discuss about the developmental disturbance of the shape of the teeth, in that gemination and fusion. Gemination and fusion can be asked as a short answer question. First, we discuss about the gemination and then fusion. What is gemination? First thing, gemination, it is a developmental condition which affects the shape of teeth, means shape of the teeth is disturbed. Okay, gemination, it is an attempt of a teeth of a single tooth germ to divide into the incomplete formation of two teeth. First, what is gemination? It is an anomaly which arises from which forms attempt at a division of a single tooth germ. So, what is the difference between the gemination and the fusion? In gemination, the attempt at a division of a single tooth germ to form incomplete formation of two teeth, but in fusion, it is an attempt at a division of two tooth germ with complete formation of one teeth or two teeth. So, gemination anomalies which arise as a attempt at a division of a single tooth germ that result in an incomplete formation of two teeth. The structure is usually one with two completely or incompletely separated that have a single root and a root canal. It is seen in deciduous as well as the permanent dentition. The term next thing is twinning. What is twinning? Twinning means what? It is used to designate the production of equal division. It results in a one normal teeth and one supernumerary teeth. See the difference between gemination and fusion. In gemination, two incomplete two teeth are formed, but in twinning, two complete teeth are there. First is in twinning, that is a production of equal division resulting in one normal teeth and one supernumerary teeth. Then again, what is supernumerary teeth? Supernumerary teeth means extra teeth. So what is the definition of gemination? It is an anomaly which arises from an attempt at a division of a single tooth germ that leads to what? Incomplete formation of two teeth. And what is twinning? It is a it is a production of equal division of teeth that leads to complete formation of one normal teeth and one supernumerary teeth. Supernumerary teeth means what? One extra tooth is there. See, this is what gemination. This is a gemination part because the gemination means it attempts a single tooth germ that leads to incomplete formation of two teeth. This is the clinical feature of a gemination. This is also a gemination. Incomplete formation of two teeth, and it has a single root and a single root canal. This is important for you. What is gemination? It is an attempt of a division of a single tooth germ, and on the radiographic examination, it has a single root and a single root canal. Why? Because it is an attempt of only a single tooth germ only. The next anomaly is fusion. What is fusion? It arises through a union of two normally separated tooth germ. Okay, it consists of two tooth germ, and in gemination, only one tooth germ is there. Depending on the stage of development of teeth at the time of the union, it may be complete or incomplete. What are the etiological factor which causes fusion? It may be due to some physical force or during trauma or during pressure that it produces contact of the developing teeth and it causes subsequent fusion. What is main thing in fusion? There is a division attempt at a union of two normally separated tooth germ, and it consists of two tooth germ. If contact occurs early before calcification begins, the two teeth may be united to form a single large tooth. If the contact of the teeth occur when a portion of the tooth crown has formed, then there may be a union of the root. Tooth may have separate or fused root canal, and the condition is common in the dentition, deciduous as well as permanent dentition. The possible clinical problems related to appearance in fusion is spacing problem is there and periodontal condition. What is the difference between the gemination and fusion? It has a single root and single root canal, but the two crown, but only one root in gemination. But in fusion, what happens? It consists of two tooth germ. Means what? Two crowns and one root. This is your fusion, means two crowns but one root. This is also fusion cases. These are all fusion clinical picture of your fusion of the teeth. The next anomaly is concrescence. This is also important for your MCQ. Then there is a cast in the department of the tooth is there for the concrescence. What is concrescence? A form of fusion which occurs after root formation has been completed. So what is the definition of concrescence? It is the type of fusion which occurs after root formation has been completed. This is important for you. For 5 marks in the spotting exam, what is concrescence? It is a form of fusion which occurs after root formation has been completed. The teeth are united by cementum only. This is also important for your MCQ. In concrescence, the teeth are united by what? The teeth are united by cementum only. It is the type of fusion or a form of fusion which occurs after root formation has been completed. What is the etiological factor of concrescence? Though it arises as a result of traumatic injury, traumatic injury or crowding between the teeth that causes what? Crowding between the teeth or trauma to the teeth that causes loss of interdental bone. So that the two tooths are in an approximate contact and they become pushed by a deposition of cementum between tooth, and they could lead to what? The teeth are united by cementum. So what are the etiological factors in concrescence? It arises due to the pressure, trauma or crowding of the teeth that leads to loss of interdental bone, and the two teeth are fused or united by cementum only. In simple language, the concrescence is the teeth are united by cementum. Why? Because there is a trauma, there is a crowding of the teeth that leads to loss of interdental bone. So the two tooth are in approximate contact and they are joined, or there is a fusion and they are united by the cementum only. It may occur before or after teeth have been erupted. The diagnosis is by radiographic examination, and the fused teeth that leads to extraction of one may result in extraction of the other. This is the clinical feature